Reading up on the latest findings, the director of the university's AIDS epidemiology group says HIV diagnosis in New Zealand remains high. That's based on the department's latest release of data.
Well, there were 224 people diagnosed with HIV in New Zealand last year, or rather were found to be infected, because actually 39 of them had previously been diagnosed overseas.
The numbers are similar to 2014, but they're high compared to years prior.
So we certainly saw an increase, and the increase was mainly among men who have sex with men, which had gone up in those last 2 years.
In fact, 68% of all last year's diagnoses were among that demographic. Just 19% were heterosexual men and women, and a few people contracted the virus through injecting drugs. One child was infected overseas, having been born to a woman with undiagnosed HIV.
The concern really is that HIV is a preventable disease. It's an infection. There are ways that spread can be stopped. So it is a concern that numbers, not only that they're not going down, but they actually appear to be going up.
He also says in the last 2 years, more people have been getting diagnosed early in their infection,
which indicates an actually increase in incidence among gay and bisexual men. So that's really a worry.
AIDS is a late stage of HIV, and there are actually fewer people being diagnosed with AIDS. Associate Professor Dixon says that indicates treatments are stopping the progression of the virus, which is positive. But he says in terms of HIV infection, the problem's getting worse rather than better. Rosie Mannins, 39, Dunedin News.